Thanks very much, Michael. That was I appreciate that, and thanks, for everyone who's been involved in organizing this. It's been an amazing experience again. Last year at this time, I was I think something like 2 weeks into the job when I came to this. And it was an amazing experience then, and it's been, now that I know a little more and and have a bit more of a place here, it's been a terrific experience again this year. So thanks for all of your energy and your time that you've been putting into it. What I'm going to do is I'm going to talk about the Health Initiative for Men. I'm kind of giving you a meta presentation, if you will. I'm talking about a presentation that we give to people, talking about the Health Initiative for Men. I know many of you are already involved in this kind of work, so you'll be looking at some of the things that we do and saying, yes, that's very similar to what's going on across Canada and other organizations as well. What I also want to talk a little bit about, though, is the philosophy behind it and how it ties in with some of the things we've been talking about, including the determinants approach and even incorporating a little bit of what I can of the intersectionality approach we were talking about earlier. Yes, so from time to time, and I've been changing my notes as we've been going. I didn't get it all onto the slide, so some of the things I'm going to try and do from memory, so do forgive me if I do have to kind of pause and take a breath from time to time and think about what it is that I wanted to relate this to as well. So I guess we'll just carry on. One of the questions that we get asked a lot, and this is why we want to bring this presentation out to people, is why him? Why a gay men's health organization? And again, especially that might happen in the context of why not another ASO, or why not in the context of a HIV organization? Well, we know that gay men face challenges that are different from other groups. We've been talking about that quite a bit today. One thing that's also happening now, though, is that gay men are recognizing the role of their communities in supporting good health. And when we talk about that, I don't only mean our community, the community of gay men, but the community in which we are embedded, and also the sub-communities within our own larger community, and that all of those communities have a role in supporting good health. The other thing I think that's important that's happening right now is gay men are working together to take ownership of their own health. And, this is a great example of it here. Although, again, when we talk about this outside this kind of an environment, that's an important thing to get across to people, is that we are taking responsibility. Some of the indications we had from the Man Count survey show that as individuals we are, and also as a community. Gay men are also taking an asset-based approach, and this is something that I think is one of the foundations for him, is that we build on foundations that already exist, relationships that already exist, and on the good things that we know that gay men have. Gay men's health is, of course, much more than just avoiding HIV infection. And sometimes when I do get asked about why him and why a gay men's health organization is not emphasizing HIV, or is not strictly devoted to that, it's because if there was no HIV, there still would be lots of gay men's health issues that need to be addressed. And it's important that we don't lose sight of those as well. I'm going to pause here for just a second, because one of the things that I wanted to say early in this was the support that we get through Vancouver Coastal Health, who provides the majority of our funding. One of the things that I've really been delighted in is our contract manager completely subscribes to this notion as well. In fact, we've had lots of discussions where she's been saying, we've got to make sure that we're not pulled too far away from that central concept of an integrated approach to gay men's health. So I really do appreciate that we get that support from VCH. The other things that we're dealing with, and again, a familiar theme for all of you here, is the interrelationship of the risk of HIV infection with other factors, and that's generating new challenges. And we've talked about things like mental health issues, drug and substance abuse, so on and so on. And we're just finding out more and more about those challenges as we get more research in. And the last is that gay men's health determinants are still unknown. We've had discussions today about what order are they in and what's important. And they also vary from individual to individual and from community to community. We're going to find out a little bit more about that tonight with the pig sex workshop. Things that we do know, though, is that HIV transmissible behavior is on the rise. We're seeing that showing. Testing has been declining. Networking online is increasing. Community involvement is, I have here decreasing. This is one of the slides I didn't get to make a change to. It's actually changing in a lot of ways. And when I started to look at this and said the community involvement that we were talking about that's decreasing was sort of the bar community. But there's also online communities, and that activity is actually increasing. So there always has been since very early days, some of the first summits with support for a standalone gay men's health organization here, and we're really delighted with the work that the board and the founders, Philip, people who are involved in getting the organization going, have been able to get that support and get that rolling. I'm actually going to just skip ahead on this. Soon after I started, the board, our staff all got together and took a look at the mission. The mission was expressed very briefly before, the mission of him to strengthen gay men's health and well-being. And we looked at how we could turn that into something that could be a driving force for our organization. We wanted to have imperatives that came from that mission that said this is what we must do. So we strengthen gay men's health and well-being, and we do it through trusted, tailored, targeted, research-based health promotion services. This slide I often spend quite a bit of time on because it's one of my favorite, although you can see it's full of words. We want to be an organization that's trusted by people. That informs all the information that we can provide. If it's not a trusted source, then it will not be accessed and it won't be believed. Tailored, we're looking at how do gay men access information? How do they access it in different ways than other individuals do and other communities do? Targeted, when we talk about that, we're saying who needs this information so that we can actually have an impact on the populations that are being affected by the issue that we're dealing with. And of course, research-based as much as we can. All of us here are suffering a bit from a dearth of research, and there's lots of discussion around whether the research is of high enough quality to be able to make decisions. But as much as we can, we're basing our decisions on research for health promotion. So there's a whole series of health promotion services I'm going to talk about in a couple minutes. The second imperative is by engaging the community through volunteer involvement, online access, and events. And this, for me, is the real crux of the organization. Everything that you'll see that we do has a volunteer component to it, and we do that because we know that once a person is involved, as we talked about earlier, gay men taking their own responsibility, they act, not only do we get lots of work done, which is also a very good thing, we get thousands of condoms stuffed, but we know that we've then recruited an ambassador for the message of gay men's health and the concerns of gay men's health. And we know also that those people go into the community and use their own networks. And those are trusted networks, and those are targeted networks, and those are networks that are for gay people and by gay people. And if we can get that information out through that volunteer involvement, we know that that's a very powerful way to do it. I'm going to talk quite a bit about this last one because those other areas are probably things that many of you are familiar with, and they're things that are going on in lots of organizations. What we're also trying to do is foster mutually beneficial relationships among gay men and health professionals to ensure the best possible outcomes. A little bit of a mouthful. I'm trying to condense that one, but each word has meaning. When we're working with other healthcare providers and healthcare professionals, we want it to be successful for both. We don't want it necessarily to be competitive. So in our work, wherever we can, research-based, trusted, tailored, targeted, wherever we can, volunteers involved and community members involved, and wherever we can by making partnerships with other healthcare professionals. And that means not duplicating, or at times maybe duplicating something different, but ensuring that we have these beneficial relationships and that we keep those up and do what we have to do to hold up our end of those relationships. And then we talk a little bit about the value here. We value the ability of gay men to make informed decisions. We value the role of our community, as we talked about earlier. And we value scientific research. So we just wanted to put all that up front. And again, the people who I've been working with, that I've gone through this with, have really seen that as being something new and exciting and different about him compared to other organizations. So let me carry on to show you a little bit about what some of those health promotion services look like, and I'll go through this relatively rapidly. So we, of course, have a website, our major one. Check them out. We also have smaller websites like What Are You Waiting For, which was a testing campaign that we have. We have one now. You'll see these images up here, definitely tailored and targeted. And these are images for our campaign that we have going right now on Do the Math, which allows people to kind of calculate their risk and make some decisions and start some dialogue around what risk looks like. We've had campaigns for condom distribution. We had an anti-homophobia campaign. This is an example of our website and how it looks. It's going to be relaunched in December, so it'll look totally different. So let me skip past that slide. We have club cards that go out, as is fairly common. Again, this is an example of our microsite we had for testing, and that information is still there. So people can go and get information about the rapid test and the early test. Volunteers, modeling, I don't think I pointed that out. Volunteers also helping with those campaigns, reviewing the information, looking at them, giving us focus groups, being involved in the creative. All of those involve, I mean, it's much more than what the small group of us can accomplish by ourselves. Many of you may be familiar with Frank. That sort of came out of there and also was one of the small websites that we're going on, and that was a collaborative effort as well. Again, this is some of our outreach kinds of materials that we're producing. We're really taking a push to go online, and we're getting information from our community that talks about where to go online and what parts of the online world they're accessing, and that's how we make some of those decisions about where to put those banners. And this was a very popular campaign that we did. The Olympics were coming, and we wanted to make sure that people knew that Vancouver was a safe space and that we had some visibility. So we put a kiss on every corner, and actually that got quite a bit of pickup. We had reports from New York and London and overseas as well, people who caught that campaign. And that was one actually where a lot of people came in afterwards and said that they were really felt good about that campaign, and it drove some of our volunteer numbers up as well. So people were interested because that was such a different approach. Condom and lube dispensers. Anyone want to hazard a guess of how many condoms we hand out in Vancouver in a month? It's about 10,000 condoms a month in Vancouver. And we're dispensing that through 7 of these dispensers. I call that 20,000 guilt-free orgasms, by the way. So, so the other health promotion services, and again, every time I say this, I want to say let's not separate that from the idea that this is volunteer involvement, and because volunteers are involved, they're going out and doing this. So we go out to events. We've got guys that we've brought in and trained, and they go out as volunteer outreach workers, bringing condoms with them to the events. We partner as much as we can with other groups like this. We do workshops. We train people in how to do workshops. We figure every time we train somebody in being a leader in a workshop, we've trained another leader in our community, and we know that that's going to come back to us tenfold. So we have a series of workshops that we work on. I don't know whether any of these are. Totally Outright is one that I'll talk about a little bit more. Fruity Booty about ass health. We have peer support training so that our peer support workers are trained. And I'll talk about what they do in a minute. Art of Flirtation, assertiveness training. Some of these are all trying to get at, as you can imagine, those determinants questions that we're already talking about. Perfection is Overrated was one that we had somebody come in from outside to do. Again, another partnership. Totally Outright is again a collaborative project with CBRC, where we bring in about 25 or so guys between 18 and 26, I think it is, years of age, and they spend 2 weekends in workshops and sessions and training, and they also have an outreach experience as part of that. We partner with a lot of people to come and give them information, and then they become ambassadors for healthy sex and healthy gay lifestyle, if you want to say, in the community as well. So there's an example of the pictures. I mean, many of those guys have continued to work with us. I mean, I could probably say are there any totally outright graduates here, so you can see number of hands going up. As part of our health promotion, we also opened the Sexual Health Center. That's just in September was a year. So there we offer rapid testing, early testing, standard testing, STI testing. Interestingly also peer support, and this is really aimed at just giving support on any kind of subject. I know there's a bit of confusion sometimes where people are thinking that it's a HIV peer support, but it's actually active listening model where the volunteers can pay attention and take on anything that's going on in people's lives. Let them lead. Also, we have volunteer professional counselors who come in and do counseling in their own terms as well, and they volunteer their time as well. And there's another volunteer in our community, luring people in for their into the Sexual Health Center. Again, what we do is we use a lot of people who are known in the community as well, and they're happy to volunteer and be associated with him. That's Sean Horler, for those of you who might know him. And continuing on with that community engagement, some things are particularly involved in bringing in volunteers, so group leaders and facilitators. Our idea is to train people in how to be group leaders so that they can create their own groups and attacking that's determinative health around social support. We also have a lot of people coming in and working on getting those condoms into the boxes so they can be distributed. And around that sort of activity, there's lots of discussion around sex and health. Again, I'd said campaign development and administration. One thing I wanted to touch on, though, was we also get volunteers who give us professional support. So we had a HR professional come in and work with us on our employee and volunteer handbook. We've had training, excellent training in communication from a communication professional. All of this done pro bono. So we're very pleased to have that kind of support from the community as well. Right from the hands to the head. And now what I really want to focus on is this idea of fostering mutually beneficial relationships. We talk about a couple of things that we've done particularly, but in general we want to do things like partnership in summits and conferences, being able to take information out and gather information back, collaborating on surveys and research projects, working with other health initiatives, service providers and agencies. Even in our clinic, for instance, the model that we have is that we really have made a partnership with BCCDC. They supply the nurses and the basic clinical services, and we host and provide the volunteer receptionist. And so that collaboration together creates the clinic, and it wouldn't exist without that relationship. We also are in the process, and I'll talk a little bit about our PEP paper, but developing research position papers. We're talking about PEP later. We're also looking at things like HPV vaccination. PrEP is just rearing its head. Trying to think of what this is. Well, and any other ones that are sort of coming up. What we're trying to do is gather and collate the research and provide that. And also we have a lot of interest in research, both through the clinic, which is kind of a magnet for research, and through people who want to interact with the community and do research in that area. So one of the things that we started to talk about was how do gay men interact and engage with institutions? And we wanted to take a little bit of control of that. We also wanted to look at how institutions interact and engage with gay men. Are we just subjects? Are we just a special class of healthcare customer? And then also, how could we ensure those optimal relationships? Again, in the spirit of him, we wanted to take some control of that. So one of the things we've done is create this kind of a presentation that we can take out and talk to potential partners and those we want to have those beneficial relationships with. And then we developed a research and engagement principles paper. And that basically, I've talked already about why we have a HIM presentation. So let me move on to these research engagement principles. We acknowledge our responsibility to address the need for protocols for academic and corporate institutions. What we found was they are actually seeking to conduct the research, and they don't know necessarily how or what the best way to approach gay men and other men who have sex with men. We know that they carry a considerable amount of power. They're knowledge brokers. They're people who have the power to construct legitimate arguments for or against ideas. They often set the agenda for what's going to happen. So we talked about things that are measured get paid attention to. We also know that institutions have the power to affect the health and wellness of gay men. And so oftentimes they have beliefs and assumptions that we need to get involved in, and we need to either reinforce or disabuse them of. So we've created a set of principles that we've put forward, and again, these will be posted on our website. Gay men have the right to the knowledge that allows them to make the most informed decisions. Gay men have a right to their health and a role in deciding the manner in which healthcare services are delivered to them. We think that effective health promotion and service delivery engages the community and maintains relationships with community leaders and gatekeepers. And we know that research is a necessary component of health promotion, but it's only effective when it's conducted in a respectful and culturally appropriate manner. We also know that knowledge transfer is a similar thing. It's necessary to research, but again, needs to be conducted in a respectful and culturally appropriate manner. So we've put those out there for anyone who wants to engage with him as our guiding principles. Because we've been approached by so many, we looked further. We had to create some kind of a process for people to get involved with us. So we get approached all the time, and the question was, how can we interact with you? So we established a research and evaluation committee. We looked at a lot of guidance from Aboriginal precedents, from concepts that have been brought forward through the Aboriginal and Indigenous groups who had said, look, if you're going to research in our areas, we need to have some control. And we also then looked at community-based research principles and tried to meld those two together and develop these research and engagement principles. So again, our approach is really that if gay men and other men who have sex with men are part of the subject matter, that they should be upheld. The guiding principles of community-based research should be upheld in those activities, and that we work to support those. We also feel that we can help them to have the most success if they use those principles as well. So, and just as a laundry list of the community-based research principles, we're looking for community benefit. We want to see some capacity building as a result. We want to see true collaboration and a position of equity. We want to see inclusion and accessibility and empowerment that arise from these. Creating the presentation, which we've been taking out in order to foster those beneficial relationships, creating a set of principles and process for interacting. And then thirdly, I wanted to talk a little bit about what it was like to create an actual intervention in the area of post-exposure prophylaxis. So this had been discussed for a long time. It seemed to be simmering but never coming to a boil. And so, and I still stand by that there's still confusion around both the efficacy and the accessibility of PEP. There hasn't been any strong, clear statements made on that. So we created a position paper with recommendations and actions. So we're asking for there to be PEP guidelines and protocols for accessing PEP, and those in our mind first should be medical and deal with the medical issues, and then we also feel that there's a role for him in promoting the use of PEP as part of the comprehensive risk reduction and harm reduction strategies. So we know that once this protocol is in place, it isn't going to do any good, especially in the case of PEP, unless people know about it and know how they can access it, because of the emergent nature of the actual treatment, and also because of the fact that it's something that needs to be known beforehand, before it's needed. So again, earlier on, we were approached by a healthcare provider who was concerned about that inaccessibility, and so we responded by getting a working group together, community members, researchers, volunteers, developed that position paper, circulated it for review, had it published. Some of you may have seen it. And we're pursuing action on several items, including those clear guidelines that we've been talking about. So right now, I just received a note the other day. Some of this is actually kind of going on right now from the BC Centre for Excellence Committee for Drug Evaluation and Therapy. We sent it to them with a letter. Our recommendations are in that package, and we'll probably talk a little bit about that in the next session. So we sent that. They sent us back a letter saying that they've reviewed this approach, that is PEP, and they have previously advised to use that, so their support for the concept. But the challenge has been a lack of consistent coverage for the drugs, and that in fact, just recently, Dr. Montana has brought this to the attention of PharmaCare. So that was their response to us. They've agreed that they're going to develop specific guidelines for the management of non-accidental HIV post-exposure prophylaxis. They are going to develop an estimate of the potential costs involved and the logistics of implementing such guidelines throughout the province. So that's what they're going to respond with. And we had sent back to them, again, just this week, saying that our position as outlined in the paper was that the political issue of payment shouldn't delay development of the protocols based on sound medical treatment, that the development of those protocols should be made in collaboration with healthcare providers who are experienced in addressing the healthcare needs of the gay community and can reflect the reality of gay men's lives. This is one of our concerns. Of course, the process of evaluating whether PEP is appropriate is a very invasive and very personal one, and involves some knowledge of what gay men's lives are really like. And so we're continuing to be committed to supporting the development of a process for accessing PEP, and to take a role in disseminating that process to the community in a way that ensures fair access to those in need. We really do believe we have a role in this, and we're asking the Centre for Excellence to collaborate with us on developing an implementation plan. And again, we're just making the case there that it'll be of little use to have this protocol in place if no one knows about it and no one knows how to access it. So the question is, where do we go from here? I'm going to ask Richard Taylor to join us, and he's going to talk a little bit about that. Richard's been involved in treating and care in the HIV field for many years here. I trust him with my life. And thanks very much.